Joining us right now from Oakland County is the Medical Director, Oakland County Health Department, Dr. Russell Faust. Doctor, thank you very much for joining us on the MegaCast again. Good to have you with us.
Good morning, Scott. Pleased to be here.
Fantastic to have you back, and we really enjoy your public service announcement. It's one of the top public service announcements in the radio biz. We would say we're running it on high rotation. We are. So it's good. I appreciate your announcement and all of your insight and the time you spent with us in the past. So let's start out with the numbers. The numbers really seem to be improving. I would like to hear your thoughts from your desk.
Well, we have over 8,000 Oakland County cases now, just under 900 deaths, or 1,000 deaths, so 953 deaths. But we have 6,502 recovered. Across Michigan, 55,600 cases, over 5,000 deaths, but 33,168 recovered. And it's those recovered numbers that are really encouraging, give me some optimism. Of course, the total United States cases are a global embarrassment, and that's a tragedy. But I think overall, things are looking up in Oakland County. I think the other encouraging number that I wanted to share with people is that the percent positives that we're seeing in our drive up, and we have 3 drive up sites right now, and I want to remind people of those. On Mondays and Wednesdays, we have, by appointment only, drive up at our Southfield Clinic site. That's at Catalpa and Greenfield, I believe. On Tuesdays and Thursdays, we have drive-up testing at our Pontiac site. That's near the Pontiac Courthouse site. And on Fridays, we're out in Novi at the Novi Civic Center. Early on, what we were seeing is a very high positive rate, because when we first opened up for testing, of course, there were people that were not ill enough to be hospitalized, but still had symptoms, and we were seeing them come through for testing and at a fairly high positive rate. But as those folks have been tested, now we have people that are asymptomatic, that are less symptomatic, less severely symptomatic, and across the community now, we're seeing about a 5% positive rate. So I feel that that's encouraging. And one last number I'd like to share. At several places in county now, they're performing clinical trials with not the early unreliable antibody test. That is the drop of blood on a card kind of test. Those were just entirely unreliable. The tests that are being worked on now require an actual blood draw. So a phlebotomy, a blood draw in a tube. The blood is spun down, the serum is taken and sent to the lab, and they actually do a quantitative assessment of IgM and IgG antibodies. And this is still not up to prime time, shall we say. It's not up for routine clinical use, but there are clinical trials that are ongoing in several places in county now, and they're seeing across county about a 20% positive rate in the population in Oakland County, meaning about 20% of the people out there, whether they've been ill with COVID-like symptoms or not, have antibodies. Now, a lot of unknowns. We don't know whether those are cross-reactive antibodies that cross-react to the many other kinds of coronaviruses, or whether they've had COVID-19 infection and recovered, and they've mounted an antibody response. And the other big unknown is we don't know whether that provides any level of immunity, and if so, for how long. So many, many unknowns, but I think as things begin to loosen up as we move forward, I'm encouraged that we have a lot of positives. And I think the other positives, in addition to an antibody level across county, is that we have PPE now, personal protective equipment. We have masks, we have gowns, we have gloves, we have face shields for our frontline healthcare providers in EMS and fire and rescue, and we have vastly more experienced ER staff, physicians and nurses and aides, and I think we're prepared. So I don't think we'll see the spike that we saw and kind of the overwhelm of our ERs that we saw in, say, the third week of March.
Dr. Russell Faust, the medical director of Oakland County Health Department. I would never interrupt you, sir, because you, the information. No, it was good. The information you give is so great, and there's now I got about 100 questions. So we'll go back. We'll go back through. All right. First of all, that was enormously helpful information. Let me go backwards. So the antibody test, yes, we heard that the earlier antibody tests were maybe up to 50% inaccurate in the reporting. So now you have better antibody tests here in Oakland County. And just can you go back on this? Can you reaffirm that you said that 1 out of 5 people that are tested are testing positive with the antibody, so they have had exposure to the COVID-19. Can you talk about that just a little bit more?
Perhaps. We hope that that's the case. The problem with the antibody test, the true quantitative serology antibody test that is being worked on now, is that we still don't know what the cross-reactivity rate is. And to be very clear, you and I and all the listeners here have been infected with other coronaviruses. That is, there are 4 main coronaviruses, very common, that routinely cause the common cold. We've all been infected by the common cold. And we still don't know what the cross-reactivity rate is yet between the new COVID-19 antibody test and these other coronaviruses. That is, we know for a fact that they share some genes, they share some surface proteins, and it'll be a little bit before we have a sense of that. But,
Dr. Russell Faust is with us, Medical Director, Oakland County Health Department. I appreciate that. And you seem somewhat encouraged, even though if you don't exactly know where that is going. Other thing that I really, I appreciate that. The other thing I just picked out of this, we heard, and correct me if I'm wrong, I'm consuming so much information, and it's from, the general news media, and you got to be careful with everything you get, because this is complicated, and a news reporter might take one piece of this information and inaccurately report it without malice. But what we're hearing from the World Health Organization, I believe, is that it's very likely that we're going to have another, peak coming up, and that it could even be worse than what we already experienced. Have you heard that? Can you talk a little bit more? I was delighted to hear you talk a little bit more about the fact that you think these future peaks might not be as bad, but what are your thoughts again?
No, I appreciate that. So if we look around globally right now, we see that countries that had a pretty good control of this, pretty good handle on things, are now experiencing small outbreaks in areas that had not experienced COVID-19 outbreaks previously. So if we look at South Korea, for example, they have, as of this morning, have 2 outbreaks, and they're once again going into lockdown, shutting down schools. We may certainly go through that. We may experience that kind of as we enter the fall, as we open up schools, despite some, and of course, we're working with the school systems right now. We're working with businesses right now to develop some optimal conditions and yet still allow schools to be in session. And it's a real challenge, as you can imagine. Children certainly are going to give a little pushback to wearing masks. They're going to maybe not be as cooperative with social distancing as we would like or we would have optimally. And despite that, I think we'll have better control over the next wave if that does occur, primarily because we have things we should have had, we wished we had 2 months ago when that first wave hit us. That is, we have PPE now. My big concern is that that first wave didn't didn't hit us in at the same time that flu season hit us. So this coming fall, school season, flu season can be a real concern.
Dr. Russell Faust is with us. He is the medical director of the Oakland County Health Department. Often quoted, very helpful information, and we always appreciate you coming on the program with us. Dr. Faust, so what's that going to look like? What challenges will that present if we have flu and we have COVID-19 going on at the same time? Is it going to just create confusion for people as to what their symptoms are, or what problems will that cause?
Absolutely, Dave. I mean, I think the real problem is we ran into this a little bit during the first wave. That is, being able to distinguish flu-like symptoms from COVID-like symptoms are very, very similar. What we will have coming up is we will have a test. We didn't have tests early on. So we were, most hospitals were doing is ruling out other respiratory viruses that someone would present to the hospital in respiratory distress. They would test for influenza, they would test for RSV and adenovirus and other respiratory viruses and rule those out. And once that had occurred, those were negative, then they would make the assumption that it was COVID-19 and treat accordingly. What we'll have moving forward is we'll have better access to more accurate testing in addition to PPE. So it will certainly smooth out that peak. That is, it will flatten the curve, as they say. So that's a little bit reassuring.
All right. Well, that's good to hear. Dr. Faust, thank you for sharing that with me. Going back to testing, you mentioned, and thank you for reaffirming this, Monday and Wednesday at the Southfield site, Tuesday and Thursday at the Pontiac site, and Friday in Novi. All of that information is on the Oakland County website, which is linked right in from civiccentertv.com. Easy to find that. So,
and Dave, I don't mean to interrupt, but
no, please.
I just want to remind people at this point, it's still by appointment only. It doesn't require physician's prescription. You don't need to be symptomatic. You can just, call and make the appointment. And I encourage people to do that.
So let's talk about that. So you don't need a prescription. Do you want everyone to make an appointment? Are there certain people that you would prefer that they go and get this testing, whether through the county for free or one of the many other options that people have? What's your recommendation, Dr. Faust?
I personally would like everybody in county to be tested. We won't have a sense of what the community-wide demographic is for COVID-19 until we test virtually everybody. The focus right now, I'm hoping anybody who's symptomatic at all, anybody who's elderly, that is, I hate to use that term. I'm in this population.
Be careful, young man. Just watch it right now.
Exactly.
Be careful.
Let's say wise and experienced. We'll say that generation. 60 and above is certainly what would be considered the more vulnerable population for complications of COVID-19 infection. Folks that have comorbidities, that is, any chronic disease, cardiovascular, lung disease, kidney disease, any chronic disease, if they're infected, does increase risk of complication. It'd be good to know whether they're infected with COVID-19 so that their physician and hospital can be aware of that if they do present with complications.
All right, now that the people who really needed it, the first responders and others, I'll go. So I think what we'll do is we'll schedule a time, Tyler, maybe the next week, hopefully next week, and we'll just go do it live when we're on the radio. We'll schedule one of these times and see if we can do it and take people there. And then Dr. Faust, and people can see, that I assume we're still getting the swab up our nose, right? Are we still doing that for the COVID-19?
No.
Okay.
So I will tell you, everybody's profoundly relieved to hear that.
Well, I am now that I'm going to get tested.
They're not getting the brain tickled. No.
Okay.
So I will tell you that we actually wanted to know early on, and we made a comparison. So we compared nasopharyngeal swab, which is what you described, to anterior nasal, just a couple centimeters, half an inch into the nose, versus oropharyngeal swab, back of the throat, like a strep swab, and even under the tongue, the sublingual swab. And we saw the same positivity rate for all of those and people who are positive. And so because the nasopharyngeal swab has a very small risk of causing a nosebleed, I just wanted to minimize any kind of potential injury. And so we routinely do the oropharyngeal swab, the back of the throat area.
Okay. Dr. Russell Faust, he's a medical director of the Oakland County Health Department, joining us here on the MegaCast. I appreciate your time. I'll only keep you a couple of more minutes. I know you're busy. Where's all this information coming from? You keep saying we. Are you talking the global we, as in the medical community in general, or how much is Oakland County participating in the research and the new information? And when I say Oakland County, I mean you, your department, and all of the medical community. We hear there's a lot of research going on here. How much is happening?
Quite a bit of research. I mean, when I say we've done these comparisons, I mean by some of that's the royal we. I have been involved in much of the laboratory comparisons that we've done out on the drive-up testing line. So, you know, we have in the state of Michigan, our lab happens to be, I guess it's immodest to say one of the best, but we have one of the few local health departments that has an active laboratory. Let me just say that. We're actually working on some of the testing here in our laboratory. But with regard to research, a lot of what we have been doing is in collaboration with the state, that is MDHHS, Michigan Department of Health and Human Services Bureau of Labs, so the BOL. And for example, the Abbott Fast, the Abbott Rapid Test,
right,
which is a small countertop machine that has the ability to provide a yes or no positive for COVID-19 in less than 15 minutes, 10 to 15 minutes. And early on, there was question about how reliable that was. And we worked very, very closely with the state BOL to determine that, at least in our lab, it's very reliable, 100% versus the state BOL PCR test. So we've been doing a lot of that. I will say that most of the hospital systems here in county, so the Beaumont system, the Henry Ford system, and the Ascension system, which is the largest system in state, they all have ongoing clinical trials in collaboration with CDC and State Bureau of Labs as well. So there's a lot of research going on. Much of the data is cleared through Oakland County Health and State BOL.
All right. Well, it's good to hear that so much is happening here. We continue to see in the news media, Dr. Russell Faust, Medical Director, Oakland County Health Department, we continue to see in the news media that a lot of this research is going on, and we're hearing from our friends at the area hospitals talking about the different programs they're involved in, and it's always great to hear about the programs you're involved in. So, you know, we all did see this national news, 100,000 deaths in our country. And for all the accomplishments, that is a tragedy. You called it just a couple of minutes ago a global embarrassment, what's happened here in the United States. I'd just like to give you a little opportunity to talk about that a little bit more.
Well, I can't without getting into trouble politically. All I can say is that many things that should have happened did not. And you know, emergency preparedness budgets have been cut, and we're paying the price for that nationally. I think, you know, we have federal agencies that are tasked with providing services that they've been unable to provide, FEMA, for example. And we have other agencies that are unable to fulfill their traditional tasks through lack of funding and personnel. So that has been a real tragedy.
All right, I understand you don't want to step in it. I don't want you to step in it, and I don't want to step in it either. But it sounds like I just was going to write down grades. I see what grade you would give FEMA. You want to give the CDC a grade? Are they on board here in Oakland County? Are they helping out? No comment will also be telling if that's what you elect.
I'd prefer not to comment on
I
CDC.
I appreciate that information. So, are we getting better? Things getting better just overall? And we'll wrap it up with this today, because to me, from where,
Absolutely.
yeah, do you want to
Absolutely. Yeah,
just
things
talk
are
about
getting
that?
better.
Yeah.
I think we just need to accept as a society that we have a new normal. Um, when we're out and about, when we're in public, the social distancing will keep us healthy, as well as a face covering, a simple fabric mask or surgical mask. And as long as we accept that and move forward with that, I think we'll avoid the next peak.
No, it's good to hear from you. And I just want you to know, I know you're out there, but you're working so hard that maybe you're not out there quite as much as we are. And we've taken some opportunities to go visit some of these pressure points when certain parts of the economy are opening up, including for total business-like reasons. And because I have a home in northern Michigan, I was in northern Michigan. And I just want you to know I got a chance to go into the restaurants up there and the bars, and we reported live last Friday here on the show. And you would be so impressed with what's going on. People are wearing their masks. They're keeping social distancing. I was in a restaurant in Charlevoix where there was a group of guys who met every week in that restaurant for their lunch. And these were not young guys. They all chose to get together and meet, but they were in their own corner of the room. They weren't near anybody at all. Maybe they shouldn't have been sitting as close as they were together. But, for the most part, if people are doing everything they can, they're wearing their masks, they're keeping their distance, they're listening to the experts, and I think they're really trying. Now, there's some jerks out there always are. And it seems just one other thing for you, and then I'll say so long. It seems that people are being cautious, too, because beyond, at least for my reporting, beyond the fact that folks are doing what they should be doing for the most part. Today you might have heard as you were getting set up, we were just finishing up with Erica Jones, 12 Oaks Mall opens, and there's nobody there. So people are being careful. They're not just jumping out into the economy. I think they're being cautious and careful, and I don't know if you have anything to add to that. I just wanted to share my observations with you.
No, that's great. I am. It does make me optimistic.
All right. Dr. Faust, anything else? All right.
Wash your hands, wear a mask, 6 feet.
Yes, sir. Very good.
Thanks,
Thank
Dave.
you. Thank you for all the great work you're doing here in Oakland County. We really appreciate it.